Okay, please take your seats. Welcome to the 4 o'clock study session for the October 9th, 2007 City Council meeting. Roll call, please.
With the exception of Council Member Hen, who is excused, the record will reflect that all members are present.
Thank you. We have 3 items on our our study session agenda this afternoon. First, or actually 2, I'm sorry. First, we'll take clarifications of item on the consent calendar. Councilwoman Gardner.
Yes, on number 5, the stop sign, have we notified the residents? Are they aware that the stop sign is going in?
Mr. Badham?
That is a good question. I'm pretty sure they have been notified because this is actually in response to the traffic calming process that we've been doing in the Heights. So most folks should be aware of it.
Wasn't the association, didn't they request that it be done?
Yeah, they have.
Don
Yeah.
Crotty?
Don Crotty calls us all the time.
They've requested that all the traffic calming measures be done in the study, so I
Okay.
would imagine that they'll be happy to see some further progress in addition to the medium work that we did on Cliff Drive.
And on number 6, have we made our list of cities? I mean, the list here is a little odd to me. I don't know how relevant comparing ourselves to San Bernardino is. So I wondered if we had prepared our list of 5.
We'll
Or the
work with
consultants.
the consultants whenever they're hired to prepare a list. That is a part of their proposal that we can submit names of the
Yeah, I
of
know.
different
But, I mean, their
cities.
list looked pretty boilerplate, what we
Yes,
had.
it was. That was just a part of a proposal
Okay.
they would send out to anybody.
Isn't Battle Creek, Michigan, where Kellogg's Corn Flakes comes from? No. Okay. Councilman Daigle.
Yes. Question on item 10. It talks about the Jamboree Road widening, and it looks like TCA won't be providing funding. Was curious what other avenues we might be exploring to get that project funded.
Yes. As you know, the TCA is not doing that well financially, so they aren't able to help us with that project. And essentially, that project would take the place of the JR5, JR1, the JR5 flyover ramp. I think that with the new Measure M, the renewed Measure M competitive programs, which will be starting up soon if they adopt the early action plan, we should be able to be very competitive in that. So
Great.
there's a good
Thank you.
chance we'll get a chunk of cash for that.
Excellent. Thank you.
Councilman Webb.
I guess I had the same question that Nancy had concerning the cities that are shown on there, because I've been to back and forth across the United States quite a few times, and I've been to a number of these places, and I don't consider any of them listed there to be very comparable to Newport Beach or the problems that we have.
You mean Indio?
Indio, California, and the only coastal city in California that's used is San Diego, and we're not anywhere compatible to them, too, because they're considerably larger than us. So I would suggest that these must have been something that were in their computer bank that they just whipped out, and what can you do to, or how do you verify or look at the comparisons? I know they say similar income level, the 4 categories. You have average income level, top 25%. You have 50%, at least 50% of the adult population has college degrees, and the community is tourist-oriented, and Branson, Missouri is definitely tourist-oriented. I think that I agree with that. But it isn't very coastal. So how do we verify the other 15? We submit 5. How do we verify the other 15 so that there is some comparability to Newport when we do the comparisons? I think the ones listed were the ones done by the firm in terms of customer satisfaction surveys. So they have access to other information. It's really for us to be working with this firm to put our arms around those cities that we think are most comparable, that will be most meaningful, and also, like it does say, then that we could choose any 5 cities in California that they haven't even done surveys for, but we think they're very similar, and they will do
customer satisfaction surveys in those 5 cities just to compare to us.
Well, it's listed under the head-to-head comparison that are tailored to fit our needs. And that's why as I look through some of these things, there's some of them that are in the vicinity of the beach. There's one in Florida that's just inland, but it looks like it's a dot on the map and substantially smaller population. So I guess that's my question, and we might maybe query them a little bit further on.
Well, and I think the Finance Committee, could recommend some cities and come back to the council and share those with you to make sure that everybody's on the same page in terms of who we're comparing ourselves to.
Okay. Council, anything up further? No. Councilman Curry?
No items?
Mayor Pro Tem Selich?
I have none.
And I have none as well. Okay, let's move on to our first study session item, fluoride in drinking water.
Utilities Director Steve Miter is going to start off the presentation.
Thank you, Homer. Mr. Mayor, members of the council. Tonight's workshop on fluoridation in our drinking water as far as adding additional fluoridation. I'd like to start with pretty much a summary of essentially what's changed. Metropolitan Water District made a decision, and of course they're a major agency of supplying imported water throughout Southern California. They made a decision to add fluoride to the water that they supply. The water they currently supply does have fluoride in it. It varies between 1 part per million to 0.4 parts per million. And they made the decision to increase it to 0.7 to 0.8 parts per million. And of course, this is considered the concentration that provides optimum dental health. So that's what's significant about that concentration. And the city water
Considered
supply,
by who?
Excuse me?
Who established that standard?
Ed Dimley will speak more to that, but it's the Dental Health Association. And Ed Dimley later in the presentation will speak more to the science behind it. Water supply sources, we obviously supply to. We have water, imported water from that we purchase, which is about 18% projected for this year. And groundwater we pump essentially 82%, the difference. This is actually a variable number. The ratio varies. So this is actually a higher year in terms of groundwater. On average, it's probably 25% imported water and 75% groundwater. So tonight's workshop, really, we're conducting 3 components. I will be speaking to the public notification requirements. Ed Dimley, who's the senior analyst for environmental projects, is Metropolitan Water District representative, will be speaking to the actual science behind the decision they made. And George Murdoch, our water operations manager, will be conducting kind of a presentation on how it really actually impacts the water system for City of Newport Beach. Public notification. California Code Regulation Title 22 requires that any water purveyor that essentially increases the concentration of fluoride in the water must notify the public and our residents in writing. Of course, Metropolitan Water District started their public outreach program throughout Southern California based on the decision they made about 6 months ago. And our requirement to meet, essentially our proposal to meet this requirement is to assemble a informational pamphlet, which we'll go through the information we're covered tonight as far as how it impacts us, the benefits according to Met, and also provide additional resources in terms of websites if someone really wanted to understand the details of fluoridation and the benefits. At this point, I'm going to hand the presentation over to Ed Dimley, who will go through the Metropolitan decision.
Thank you, Steve. Good afternoon, Mr. Mayor, members. As Steve mentioned, my name is Edgar Dimley. I'm a staff member with Metropolitan Water District's Water Quality Section. My goal today is to go through a very brief presentation on our fluoridation implementation program, address some of the key issues that I'm sure your council is interested in, make myself available to answer any questions, and then support whatever your city hopes to do with this regard. To answer your question, the level that you asked Mr. Miter about is the optimal level is determined by the Centers for Disease Control and Prevention. The temperature-based standard that the state of California utilizes is based on a recommendation by the CDC of about 0.7 to 1.2 milligrams per liter. That's a temperature-based standard, and it's that level is considered optimal, and it's based on the amount of water that's consumed or ingested. Real briefly, background in terms of this issue. Again, the catalyst for a lot of the activities in California is centered around a piece of legislation which was signed back in 1995, AB 733, which conditionally mandated drinking water fluoridation. That condition was based on the number of service connections, 10,000 service connections or greater, and if monies were available to implement. No monies were supposed to come from the state of California. In December of 2001, six county health officers representing Metropolitan's service area, including Orange County, appealed to Met's board to fluoridate their supplies. That issue was referred back to a committee of our board of directors, and their recommendation to our board of directors was to implement a drinking water fluoridation plan, which meant basically designing, installing, operating fluoridation facilities at our treatment plant. I want to make it clear that that was a decision that was made by our board of directors, which represents our service area. Again, in October 2003, Metropolitan entered into an agreement, again, for funding that was not state supplied. It was from an entity, a healthcare entity. The California Endowment awarded money to an organization known as Fluoridation 2010. That money was granted to Metropolitan, and the $5.5 million represents the cost to install facilities at our 5 treatment plants. And again, Met's board authorized funding for the design of those fluoridation facilities at the cost of $1.2 million.
Can we go back to the first one there?
Yes, ma'am.
AB 733. You said of a certain size you're required to fluoridate?
The bill, as it was written and is signed into law, mandated fluoridation, if monies were available, to water systems of 10,000 service connections or greater. For the record, that does not include the Metropolitan Water District. We're a water wholesaler. We do not have 10,000 service connections or greater.
All right, so you don't have to, you don't come under AB 733.
That is correct.
All right, and then can you tell me anything about this Fluoride 2010? Who makes it up?
It's a group of state agent, different state advocacy groups, fluoridation concerns, most notably the California Dental Association Foundation. There's a representative from the state of California, their drinking water program, and also folks, advocates on behalf of dental reduction or the prevention of dental disease.
The California Dental Association, we have in the past lots of groups that, you know, say they're calling themselves green things and they're doing bad things to the environment. So we always be a little careful about the names of things. The California Dental Association, is it associated with the American Dental Association? Is it actually dentists, or is it another kind of group?
It's a California Trade Association.
Okay.
Is fluoridation of water isn't a new concept? Is, nationally speaking, is California or your district slow to that? I mean, what's the history there?
Yeah, as stated, drinking water fluoridation has an approximately 60-year-old practice in this country. There have been several water districts locally that have long histories, most notably Long Beach and Beverly Hills. They've been fluoridating their water supplies since the 1970s. The city of Los Angeles, which is the largest municipal water district in the country, has been fluoridating since 1999. And locally, Fountain Valley and Huntington Beach have been fluoridating their water supplies for a number of years.
And Mr. Donnelly, if I could ask, specifically, what is it that we're fluoridating for? What is the social purpose we're trying to achieve by fluoridating?
It's a medical purpose. The theory behind the practice is that at an optimal level, medical professionals and the scientists will indicate that at an optimal level of ingesting fluoridated water at an optimal level will reduce the incidences of dental caries or dental cavities. That is the rationale or the science behind the practice.
And why is it, has it been for the past 30 years, that Met Water has chosen not to implement fluoridation in its service area?
I cannot speak to why our board has not done this. We have a board at one time that was 51 members, which was, as I was told, the second largest governing board in the state. I can't speak to why it has not happened. There were two catalysts that prompted this. One was the change in the law in 1995, and the second was this collaborative act by the county health officers of our service area. They were advised to appeal to our board to consider this. They did, and after study and recommendation, that's what's basically what prompted Met's board to take this action.
Thank you.
Who from Orange County is on the MWD board? I mean, is there an agency that sends a representation?
I apologize. It's the Municipal Water District of Orange County. They have currently have 4 representatives on Metropolitan's board of directors.
Okay, so that Orange County is represented in the decision-making process for MWD.
Specifically, the agencies that receive metropolitan water through the Municipal Water District, they decide who represents the MODOC board, so to speak, on Met's board, and that's the representation. And thank you for not asking me to name those individuals.
No, I won't do that.
Excuse me, one more quick question.
Sure.
Is this for information, or do we have a decision to make here? Is this, once Met's made the decision, is that the decision-making body, or why are we talking about this today, other than for the medical knowledge of it?
Well, there is mentioned earlier by Steve, there is a notification requirement that is a part of this program. And I guess the city of Newport Beach is rolling it out as part of this workshop.
But the decision to fluoridate or not fluoridate is not a discretionary decision of the city council?
That is correct.
That's right. I think our decision would be, we either don't take water from Met and don't fluoridate, or we take water from Met and fluoridate like we're doing now.
Thank you.
Very briefly, this is the schedule of our treatment plants. I won't go into any detail. This is a picture of a facility at one of our treatment plants. This is a standard water treatment chemical facility, as the tanks that are used to house the fluoridation chemical.
And what is fluorosilicic or silicic? Is that a form of fluoride?
Fluorosilicic acid is a solution that, when introduced into a water column, will completely disassociate. What you will experience is an increase in fluoride ion concentration, but there's basically 3 types of fluoridation chemical that's accepted as part of the practice. And Metropolitan is using fluorosilicic acid because we operate 5 of the largest water treatment plants in the world. The other 2 types of chemical, which one is a powder, one is a granular chemical, would not be practical for treatment plants that in some cases can treat up to 1 billion gallons per day.
These others, are they, but they are also this fluorosilicic acid, or is it a different, completely different form of fluoride?
That's correct, yes.
The acid, you know, obviously, to somebody who's not a chemist, it always raises a question.
Yes, ma'am. It's a solution, and what I will offer to you and to staff, without making this a highly technical presentation, we can make that information available to you. More importantly, if it's necessary, we would invite you to visit our facilities. We could have treatment experts explain the process. But I think what you need to know is that decision relative to fluorosilicic acid is a change to our treatment process, and to do that, we have to receive a permitted change from the state of California to do that. They regulate and oversee every aspect of our treatment process. It's not a decision that's made strictly by Met staff. It's overseen by federal, state, and local officials on not just fluoridation, but all treatment aspects. One of the other issues, very quickly, that we get asked quite a bit about is the cost. At the time we asked our board to consider this issue, these were the costs that staff estimated at the time of their decision. I would urge you to keep in mind that chemical costs change daily, but this is what we quoted to our board, and this was part of their decision-making process, was the cost to Metropolitan and to install the facility.
Just to put that into perspective now, the $1.75 is per acre foot, I take it?
Yes, sir, that is correct. And let me also point out that your agency will not see any incremental change in its rate structure as a result of this practice. We have other treatment processes as part of Metropolitan's facilities. This is captured in that treatment cost. Some will make issue, but the $5.5 million in capital cost is indicated there. That money was granted to us. As part of the refinement of the LAR guidelines is that we were expected to pay O&M cost in perpetuity. I won't spend much time on this. We were initially scheduled to bring all 5 treatment plants online at the same time. We're not going to do that. I think what you will want to know is the start of our Deemer plant, which services Orange County. I'll talk about that very briefly. This is a map of our service area. Our Mills plant, which services Riverside County, will start October 29th. That will be the first of our 5 treatment plants. None of that water goes to Orange County that I'm aware of. That'll be followed by our Skinner plant, which services primarily southern Riverside County and San Diego. All of the water that we import to San Diego comes from this plant. The next plant will be our Weymouth plant, and followed by the Deemer plant, which services Orange County, and that will start on November 19th. And then lastly, our Jensen plant, which services the northern portion of our service area, including Ventura County, will be our last facility that goes online November 26th. I'm going to spend a little bit of time about our outreach program that was mentioned by Steve. Part of the rationale for developing our program was that we were not developing it just for Met. It was part of a regional message to some 350 agencies that take Met water. The goal was to develop a consistent message and provide support to member agencies in sharing information, news reports, et cetera. I want to make one thing clear, that there's been a lot of information on this issue. There is a lot of information. There's a lot of misinformation. Our job as staff, as is mentioned, is to give you the facts as accepted, not just by Metropolitan, by other regulatory agencies. That has been our job. Also to make sure that the information that we give you is close to facts and to undistilled as possible. And again, there's lots of critics of this program, and we have been asked to get information as accepted by regulatory agencies and other officials. Again, part of our practice is modeled on what the City of Los Angeles or the Department of Water and Power has done in rolling out their program in 1999. Again, here are some of the agencies currently fluoridating. Many will be receiving Met water. Simply what they'll do is just turn off their facilities and enjoy the benefit. 2 of the agencies I mentioned earlier were the City of Huntington Beach and Fountain Valley in this region that receive water through the Municipal Water District of Orange County. Again, our responsibility as a water wholesaler is to support our member agencies. Metropolitan has been involved in a number of workshops and different briefings on this issue, such as today. We've been working with the California Dental Association, again, which is a trade group here in California, along with local health departments, in taking the lead in doing a lot of the medical rollout. I should make it clear that I am not a medical doctor. I can't speak to a lot of the issues relative to health effects, but in the past, when I've done these presentations, and that's been an issue, I've come out with state and local officials, and if that is an issue which you'd like to address, I would urge you to certainly do that. There are certainly authorities locally, either in Orange County Health Department or the State of California, or if even necessary, the Centers for Disease Control and Prevention. Again, Metropolitan provided background material in an attempt to get a consistent message. We made that available to the city, as you will see, as part of their outreach program. And again, we worked with the County Health Department and CDA to provide notifications. One of the issues that you should be aware of is that in addition to retail customers, the medical community needs to be notified, because they supply, folks that supply dental supplements have been asked to discontinue that so that they don't get more fluoride than they need to be exposed to. And then that notification is being handled by the County Health Department with leadership by the CDA. I think I'm supposed to turn it over to George at this point.
Just a minute before you sit down.
Sure.
You say that they don't want dental supplements. What about fluoridated toothpaste. Is that considered a supplement? Are we all supposed to start changing the way we brush our teeth?
No, because the benefit of drinking water fluoridation is through ingestion. Fluoridated toothpaste is topical. Although kids do put it in their mouth, they're not advised to swallow it. The fluoridated drinking water is the benefit of fluoridation. It's not through topical application.
Mr. Dimely, if there is such a thing as having too much fluoride, what if you just drink a lot of water? I mean, how do you self-regulate against taking too much?
I should mention that the standard that was developed is based on a very conservative estimate of the amount that they ingest. The Centers for Disease Control and Prevention, again, recommends a level of approximately 0.7 to 1.2 milligrams per liter. As a matter of fact, the state law relative to fluoride is 2 milligrams per liter. As you can see, the level that we're fluoridating to is on the very, very conservative end. You'd have to drink an awful lot of water at that level to get too much fluoride from ingestion of it. So to answer your question, the levels are based on the assumption that you are drinking a certain amount of water per day.
Thank you.
I will remain after the presentation in case there are additional questions. Thank you very much for your time.
One further question.
Sure.
Your name?
I'm sorry, my name is Edgar G. Dimely.
Dimely. That's a very well-known name in Los Angeles. Are you related to the family?
Yes, Mervyn Dimely is my uncle.
Oh.
Well, good afternoon, Mayor and members of the council. I'm George Murdoch with the Utilities Department. And my portion of the presentation is how does this affect the city of Newport Beach? Well, as Stephen mentioned earlier, we have two sources of water in Newport Beach. 18% of our drinking water comes from the Metropolitan Water District for this year. As Steve had mentioned, year to year this percentage changes, but currently we're taking 18% of our water from Met. That's the current levels, as shown here, are 0.1 to 0.4. They'll be raising them after November 19th to 0.7 and 0.8. 82% of our water in Newport Beach comes from our well sources. These are our 4 city-owned wells in Fountain Valley. There's a natural occurrence of fluoride in the water already, and this level is 0.24 to 0.42. So that's just the natural occurrence of fluoride that's in there that we currently are serving our customers. These percentages, this is an annual average, so from fiscal year, by the end of June, we will achieve that 82%. We try to take advantage of our wells. But from month to month, we vary these percentages. So the point I'm trying to get at is that blending these two sources, the level of fluoride is going to vary in our system. So in estimating the concentrations of fluoride in our distribution system, basically all of Newport Beach is receiving and will receive some level of fluoride. It has been. The fluoride levels vary between 0.2 and 0.8, with the well waters being 82% at an average of 0.3. You can see when we blend the water that there's going to be a varying level. Water source affects fluoride level, which I just spoke to. The best way to kind of explain this is how our water system works, and I'll try to give you a simplified version of this. Here's a map of our water system, and the colors represent pressure zones. The pressure zones, there's 5 main pressure zones in the city of Newport Beach. Each pressure zone also delineates water source. We have the ability to supply each one of these colored areas from different sources. But I'll take the simple one first, and that's our groundwater. Our wells water comes in from the from Fountain Valley, city of Fountain Valley, and it's pumped in the west end of Newport Beach to our 3 million gallon reservoir on the west end of town. And from here, we pump the water into what we call our Zone 2 and Zone 1 area. That's the area that's represented here in the green highlighted area. This area primarily is groundwater, which is the average of 0.3 milligrams per liter or parts per million of fluoride. Water that's not used in this area in the evenings and low demand periods is stored in our Big Canyon Reservoir in Corona del Mar. This is a 195 million gallon storage reservoir in Corona del Mar. So the well water is stored in that. The Metropolitan Water District connection. So now I'll flip to that side. This is the water that will be increased to 0.7 to 0.8. We have 2 main connections with Metropolitan Water District. The first of which is this CM8 connection. Now this connection feeds directly into that Big Canyon Reservoir. So that 0.7, 0.8 parts per million is going to blend with that well water. So the levels will vary. Again, that's where we get that 0.2 to 0.8. It's going to blend in this reservoir. The second connection we have is the CM11 connection, which is located up on Ford Road. Now, in combination with CM11, Big Canyon, and CM8, we feed water to the higher pressure zones in Newport, in our service area, which is highlighted here in the blue. So this area is going to receive the varying levels of fluoride from 0.2 to 0.8, whereas the green area there will primarily be served by the groundwater. So in summary,
And
Go
back.
ahead.
Can you go back to the map, please?
sure.
And what's the story on the brown area, 04 and 05?
That's the 04 and 05. I've tried to cover that. That's Zone 4 and Zone 5. The water is pumped from our Big Canyon Reservoir up to another reservoir up in that Zone 4, the little brown area. See if I have a little. There we go. There's a little reservoir actually up here in Spyglass, and that feeds the brown area here. There's another pump station up here that feeds the upper, very top pressure zone that we have here in the city. But all that water supply is coming from either the Big Canyon Reservoir or this interconnect. So I lumped them kind of together to simplify it.
Another question.
Sure.
I know we don't, it's IRWD in Newport Coast,
Correct.
but do they get Metropolitan Water, do we know?
That's correct.
And are they going to be doing their own outreach?
They actually sent out a flyer in their last month's billing, and they identified their natural occurrence of fluoride in their well water as well as metropolitan connections that they have. A lot of cities are blending.
Did we get any?
sources.
I didn't get any phone calls on that. Did you get any? Haven't heard.
So really, in summary, the fluoride levels in the city of Newport Beach are going to vary between 0.2 and 0.8 throughout the entire distribution system. The source water, depending on where we get the water, and I'm sorry, but we vary this amount based on demand, weather, where we need to push the water in the city. Where we get the water directly affects the fluoride levels. We are initiating a fluoride monitoring program in November when MET kicks off. So we'll have a true idea of this blend or what's happening in our system, and we'll initiate this next month. The fluoride levels are included in our annual water quality report. They were in this year, the one that we sent out in July. They will continue to be in our annual water quality report that we put out every year. I wanted to pop up some contact information here. For more in-depth information on the Metropolitan Water District system, they have a hotline that they've set up, the 1-800-354-4420, and also their website. That link that's posted here takes you directly to their fluoride page to get some information. The American Dental Association also has some information on their website about fluoride in general. And of course, anybody can contact us directly at utilities. And we've also set up a new email address if that's easier for some folks to contact us. So with that, that kind of quickly goes through how our system works. Is there any questions? Seeing none? Okay.
Okay, does that conclude the staff portion of the report?
Yes, it does.
Okay, thank you. We're going to open it up for public comment now, and I believe that there's someone who would like, calm down, Larry.
There's another presentation.
Someone who would like to make a presentation as well. For this person, because of the complexity of the material, we're going to allow a little extra time other than our normal 5 minutes. But that will only apply to this presentation.
And for that, I thank you very much. I'm actually going to show you two presentations.
Could you introduce yourself first?
Oh, I'm Dr. David Kennedy. Actually, if we go back here, I'm that guy. I'm the past president of the International Academy of Oral Medicine Toxicology. That's an evidence-based organization of dentists, and it's not a trade association. It's a nonprofit educational corporation. And that we're the people that do risk assessments on the materials that you use in dentistry, mercury, fluoride, root canals, bacteria in your mouth, and so forth. And I'm their fluoride information officer. I conducted a risk assessment for this issue in 1998. The information is not much different. Today, the American Academy of Pediatrics recommends that infants receive no fluoride whatsoever. So water fluoridation delivers to an infant on a baby bottle a dose of fluoride that would be gross malpractice if I were to write a prescription for that, or any physician were to do that. So basically what we have is municipalities delivering a drug to children at a dose that is known to cause harm. Therefore, you have a duty to inform the recipients of the water that they're going to damage the child if they make up baby bottle formula with this. And that the Metropolitan Water District said they did not have that duty, and they don't intend to inform you of that. You
I have
can
a
find it
question.
on their website.
Can I ask you a question?
Yes.
In terms of the amount that a prescription is required, how can you compare that? How would you compare that amount subject to a prescription to the amount in the water that the district's going to do?
Okay, I blew past that, but let me get right back to it. A baby on formula drinks approximately a liter of water a day. 4 of the 250 cc bottles will feed an average healthy baby. If they've got kidney problems, they may take 2 liters a day. That if you look at the graph here, this is from the prescription dosage. This is from the people that advocate fluoride, internal exposure for fluoride. The IMT does not. But their schedule shows that if you drink a liter of water, you'll get about 1 milligram a day. So that would be a child up to the age of 6. 6 to 16, that's the recommended dosage. And so fluoridation would give an ordinary infant the dose of a 16-year-old, or if they're a child that has kidney problems or something like that, they would receive a dose twice that. And that's why it's gross malpractice, because nobody, your physician, cannot write a prescription for you that's outside the parameters of the dosage schedule, because we know what's going to happen. When we get to it, I'll show you. What happens is dental fluorosis, and it's already occurring even in non-fluoridated areas. Did I answer your question? Okay.
Well, I got a question. The presentation that we just had said that just in the natural water we have up to 0.42 parts per million, which is right in the middle of your chart there. So just the natural water in its own seems to violate the recommendations there.
You're correct. And let me show you, there's a very subtle shift that happened, that Mr. Dimely moved from a concentration in water to a dose. You see what's happening? Is it this is talking about how much the person drinking that water gets, while he's talking about how much there is in the water. And those are two entirely different things, and it's a bait and switch thing where you go from concentration in water to dose received. And so the dose an infant should receive is 0. The concentration in the water, even your water at a fairly low level, a baby drinking a liter of formula a day would receive a dose that will cause dental fluorosis. And when I get to my graph, I'll show you that in areas that have 0.3 parts per million fluoride in the water, there's 14% of the children have dental fluorosis, which means that the exposure to fluoride is already excessive even before you get the additional exposure from the met, if you consider dental fluorosis a problem. Here's the American Dental Association, which said recently that if the baby drinks liquid concentrate or powdered formula, and the primary source of nutrition is from the water, because breast milk has no fluoride in it. So they're saying if you're using formula, then use fluoride-free. And that in the city council meeting in San Diego, the fluoridation task force was there, and the president, Scott Peters, extracted from Howard Pollack the statement that is what Dr. Kennedy's saying true, and Dr. Pollack said babies should be breastfed. And Scott, being a lawyer, he said that's non-responsive. I'd like to know, is what Dr. Kennedy's saying true? And Howard said, well, it is true that you should distilled water. He said, what? He said, you should make up formula with distilled water, fluoride-free water. So even the fluoridation task force now acknowledges this point is true. And I say that requires notice. And why? Because it causes dental fluorosis and skeletal fluorosis, but the skeletal fluorosis is a much more subtle nature. Dental fluorosis is really visible. If you don't believe that, open up the yellow pages and see how many dentists are now practicing bleaching, because that's what you do to that. You try to make the tooth totally white and get rid of the brown. This is a nationwide survey. That's not actually San Diego there. That's the whole nation, 39,000 children, 84 different communities, showing that the amount of dental fluorosis varies consistently and this is old data. This is 1987. It very consistently varies with the amount of fluoride in the water, and that means that that children are exposed. Dental fluorosis is a proven adverse health effect. The state of California acknowledged that. And that this was a slide presentation I prepared for the Met, and I asked them to inform the public, and they said, we're not required to. And we're not required to for exactly what Mr. Dimely was saying, is that the maximum contaminant level in California is 2 parts per million. So you could actually pump out water that is known to cause injury, and because of the maximum contaminant level, that little piece of paper you get every year in your water thing is sufficient. And let me go through, this is a beautiful presentation. You can see it on YouTube. I put it up there. It's called Poison Babies. This is Dr. Thiessen. She sat on the National Academy of Science 3.5-year review of fluoride, that they voted unanimously that the public health goal for fluoride was not protective. So here's a very simple thing. It says water intake in milliliters per day, and that's what we would talk about, milliliters per day. And so you can see the infant is at the top, and then people get water. They drink water. And then this is milligrams per kilogram per day. And so that's water per pound of body. And then you have a line drawn there showing the dose from the water alone that these people would receive. And you see, so you understand, this is a log scale, so that each little notch there is 10. It's like a thermometer, like a pH. So we'd have to remove the next building to show you where the end of that graph goes. And these are the ones, let me see if I can stop it from running on. And these are the injuries that occur, and the dots you see are the studies that the National Academy of Science reviewed, showing at what levels injuries occurred in milligrams per kilogram per day, a dose. And these are the questions that the people advocating fluoridation never ever want to answer. And so what dose do you recommend? They can't answer that dose because it's highly variable, as you pointed out, Keith. If you're a runner, if you exercise outside, if you work out, if you do anything that causes you to consume more water, have a kidney problem, if you have excessive thirst, or maybe you just like to drink a lot of water, the dose varies based upon what you're doing. And those slides were from water alone. She didn't consider sources other than water, such as air pollution. You mentioned Battle Creek, Michigan. Wheaties is 10 parts per million fluoride. Cereals and so forth that are processed in a fluoridated community are high in fluoride. So if you look at all sources, the graph moves clear off to one side. And let me share with you one other bait and switch, is that they're not putting fluoride in the water. They're putting hydrofluosilicic acid. It's interesting that Mr. Dimely knows that it completely dissociates because none of the research found it completely dissociated. One study found 97%, another study found 70%. And under water treatment conditions, it's going to be somewhere in that neighborhood, 70%. That leaves in the water a substance that causes the blood level of lead in children to skyrocket. 450,000 children, 3 different states, that was showed that it doubled the number of children with high blood levels of lead. Well, what are we talking about? Hydrofluosilicic acid. What's lead got to do with fluoride? That hydrofluosilicic acid is patented. If you go to the U.S. Patent Office, you'll find that there's a patent for it to extract lead from brass. Well, fluoride won't do that. How can this substance do that? This substance is a seeker of another electron, and it takes a bivalent electron and sucks it into the children's bodies. But what, interestingly enough, is that if they were Hispanic children, they had a 4-fold increase, and if they were African American, they had a 6-fold increase. That makes the addition of a substance to the water that causes what's called disproportionate harm a racist policy, in my opinion. You don't want to do that. You are putting a chemical in the water that causes disproportionate harm. It also causes more dental fluorosis, by the way, and they showed that first in 1950. And so I believe that you have a duty to provide water to your constituents that is safe for everyone to drink. The American Dental Association admits it's not safe for the baby. We have one. National Academy of Science says it's not safe for people with kidney problems. We got 2. How many other subgroups in the population are you going to ask to abandon the water system so we can allegedly put a substance in the water to benefit teeth? And if you go to the Center for Disease Control website, you'll find, yeah, it's really good, and it works topically. That's like putting sunblock in the water because you might get sunburn. So I've taken up more of my time. I want you to listen to Jeff Green. Jeff Green and I have been working together for the last 11 years, and that city councils that want to protect the public have many avenues. There are lots of laws being broken here, not just one, lots of them. And Jeff, if you'll share with him your concerns. This is Jeff Green. He's the National Director of Citizens for Safe Drinking Water.
Yes, thank you. Some of you may have received a notice that was sent out to approximately 2,000 people who I believe were responsible parties in their particular water districts that are in what we call the chain of delivery. That despite the fact, and I recognize that in some ways it's Metropolitan Water District that's acted, however, your particular community is dependent upon you acting or not acting, not Metropolitan. And in fact, if you would talk to any citizen in your community, you'd find out that they didn't think they had any say-so in this issue at all. So let me clarify a couple things for you if I can real quickly. One of them is AB 733, the original legislation that happened in 1995, was what we call a conditional mandate. It mandated that, yes, that it had to have more than 10,000 connections in order to be considered for it to be mandated to fluoridate. But most specifically, it meant that the funding had to come from other than ratepayers or taxpayers in order for you to be compelled to fluoridate. What's happened is Metropolitan, which is not mandated to fluoridate, has made a decision that they want to fluoridate and that they're going to send water that is fluoridated to communities where the communities have never had any opportunity to determine whether they wanted that to happen or not. But there is a false statement that was made by a little bit earlier by Edgar Dimley in our city council meeting in San Diego. One of the council members asked the question very directly, what's the cost of this going to be, and is this cost going to be passed through? After a lot of double talk and everything else, it eventually came down to the fact that there was going to be a cost. It was going to be concealed as if it were water treatment. But I have to tell you right this second, if you decided that you were going to fluoridate, it's not like you could just fluoridate. You'd have to have a council decision to do so. In other words, your utilities manager could not just go ahead and do the same thing you might do with, let's say, for an example, chloramine, or as opposed to chlorine, or using aluminum in order to get rid of the extra turbidity in the water. So in essence what's happened is that it was a legislative decision that was made by the board without consideration, and I can guarantee you that you didn't make any decision in this. There was no polling by any of the member agencies of their particular recipient agencies or water districts like yourself to find out whether people wanted to be fluoridated or not. So one of the things that I included in the information that was provided to you in this, what I call a constructive notice, that as a part of this delivery, you're not delivering water anymore. You're delivering you're basically delivering a treatment for human beings in which they didn't get to participate whatsoever in it. And eventually that raised fee, because we're going through it in other communities right this second, is going to be passed along so that the individuals in this community are going to end up paying for that. Let me cut to the chase as quickly as I can in terms of what you can do about it. That certainly you're removed from Metropolitan. However, you're not removed from the fact that there are laws that have to do with what's added to your water. So let's clarify about where those laws come from. First part is that the Environmental Protection Agency gave up oversight responsibilities for direct water additives back in 1988. It means there are no federal safety standards for direct water additives any longer since that time. And that's really important to understand. The CDC does not manage or control water quality. It has no jurisdiction for that whatsoever. What you do see is that there are maximum contaminant levels that says once you don't manage your water well, that they get a chance to come in and say you can't do it that way any longer. They provide you technical information about risk assessments to tell you at what point harm can occur so that you can consider that. And they basically require that you start telling your consumers where you stand in those kind of things in the water that's being delivered. One of the contaminants that comes in hydrofluosilicic acid is arsenic. Once it's placed in the water, the measuring capacity for arsenic is very difficult unless you use more expensive measuring processes. So it could be very easy that your own water district would say, we don't measure any arsenic in our water. But that doesn't mean that you didn't add arsenic, and it also doesn't mean that you didn't add arsenic at a level that's highly significant and that causes actually lung cancer and bladder cancer. So what we found is that one of the questions that is not, nobody wants to reveal, is how much are the contaminants actually in the product itself, where you can measure it easily because it's in 50, 60, 70,000 parts per billion. And you have a difficult time measuring it in 1 part per billion, but 1 part per billion means 1 in every 2,000 people will have lung or bladder cancer at 1 part per billion. That's what's allowed to be in the water. But what we're saying is that this is a direct water additive in which there's a choice about this. So there are things that you can do. One is, first of all, you can ask questions. You have absolutely no restriction on your asking questions from who you receive water. One of the questions is, do you have a study on hydrofluosilicic acid for the long-term effects for hydrofluosilicic acid, the substance going to be added to your water? I will guarantee you that every citizen in your community would say that if they told you they didn't have one, they would expect for you to delve further, for you to go further. The fact that the United States Environmental Protection Agency cannot identify one single study on hydrofluosilicic acid and said this to Congress in a congressional investigation that we initiated, I think would be meaningful. So I think, again, if you had everybody raise their hand and say, at what point would that be meaningful to discussion? Is Metropolitan Water District telling you that they don't have one study on the actual substance? So one, you could write a letter, you could ask it from your sources of water, do they have a study or do they not have a study, and please send it. The second part of it is that what we've identified for you in the information that I put out as constructive notice was that during the congressional investigation that Citizens for Safe Drinking Water was able to obtain by the House Committee on Science, the question was asked of NSF International, which is the voluntary industry self-regulation standard that was set up that the state adopts. That's the controlling standard for the additives that are placed in your water. They were asked to send the data that was submitted by the chemical suppliers for hydrofluosilicic acid. They didn't send it because they didn't receive it. They said that it was not even submitted under Confidential Business Act. So what's happened, and I sent this as part of the information that I sent out to you as individuals, is I sent information that was a letter that was being sent from a water district to a chemical supplier that very clearly stated, first of all, is your product, we've heard all this stuff, there's lots of controversy, let's get right down to it. You're a chemical supplier, are you willing to make a statement that your product is effective at reducing tooth decay when it's ingested at the dosage rates that you typically do when you do fluoridation? Is it safe for infants, children, the elderly? And we actually basically stated in that for what we call protected classifications of citizens. First of all, were you willing to make that statement? To date, no chemical supplier of a fluoridation chemical is willing to say that their product will do what everybody else is claiming. What's happened instead is everybody hides behind the public policy of fluoridation and saying that's safe and effective. But the moment it comes down to, will this product do this, no one's willing to say yes to it. The second question that they asked, and again, it's part of what I supplied to you, and I can supply to you again, the second question was, send the toxicological data on your particular substance. They've refused to do that. The third part was, send the data that you sent to NSF International. So let me clarify. In California law, it basically states that in order for any chemical to be added to the drinking water, it actually has to meet what they call ANSI NSF Standard 60. It's the Bible, if you want to call it that, in terms of water additives for the entire United States. 45 states and most of the provinces of Canada all agree with that. So in this, in the California law, it actually states that any chemical that's added to the water must meet this standard. During the congressional investigation, we asked if they'd met that and to send the data. They did not, and they stated that they have not received that. So what this other water supplier has asked for is, send us the data that was given to NSF International to earn certification that's required for California law. Up to this point, Metropolitan Water District's not willing to do that. Mosaic, which is the company, it's kind of surprising he didn't want to mention the name of the company that's providing it here, but Mosaic didn't want to say that, whether that was true or not. And the last one, you heard a statement from Edgar Dimley saying that it completely dissociates. Well, we have documents we'll give you from the U.S. EPA in which they state they don't have any empirical evidence that says that it dissociates. And so what we asked for was, show us the data that shows that it dissociates. That up until year 2000 and 2001, 2002, the U.S. EPA is saying that it does not totally dissociate and that it's a completely separate product. So it's as simple as that, we believe. That one, if you ask the question of your suppliers of water to provide that kind of data as opposed to having to believe what I say, but you just ask the direct question, you'll find out that they are going to, I believe, and if I'm wrong, then you'll have received it. You'll have made me wrong. That's great. You'll end up with either a study on hydrofluosilicic acid, you'll end up with the data that no one else has been able to get, you'll be able to see data that nobody else has been able to prove, and you'll get a statement from them saying that their product will do what they want to. And to me, that's what your protective duty would be as what I call basically an entity that's in the chain of delivery. That anything else, if I would have been selling you aloe vera, you would expect me to have a study on it, from my product, and you'd expect me to stand up for it. Or if I were selling you concrete, and there was somebody in the chain of delivery found out that concrete was deficient. I mean, there's a certain point when everybody becomes responsible for that part. I'll answer just one or two other things real quickly, and then I'll get off the way right here. One actually had to do with the addition for substance for different purpose. The idea of a 218 was some of the information I provided, because normally in order for you to pass through costs, it would be normal for you to be able to pass that through with a 218 process, meaning that you would actually send out a notice, tell other people that you were adding additional fees to their bills because of the fact that you were basically getting higher fees from someone else. I would suggest to you that you're not getting water treatment. What you're doing is you're getting a completely different service, and that service is fluoridation. That it's our belief that if you do not identify that to the public will never know. Who will ever tell them that they're actually paying for fluoridation that everybody else believed the state said they didn't have to pay for? And then secondarily, through your own notice, if you're not identifying it as being for fluoridation, they have no opportunity to be able to say whether they're rejecting it or accepting it. And so I believe that it would be deficient if you followed through in that direction. I'd be happy to answer questions about what I've talked about or sent you.
Councilman Webb?
What studies do you have that show that fluoridation is harmful in agencies that have been providing it for a number of years?
Well,
Like the councilman here indicated that she was in a fluoridated water program since she's been born back in Massachusetts. I'm just curious about what are the current studies that show that it's really harmful.
Yeah, and this just becomes real important because most of the time when you hear this issue, it becomes a he said, she said. One person pulls out a study, the other person pulls out a study, and that's exactly the reason why I've given you the course of action. I believe that can rectify that for you, because if the manufacturer's not going to say that hydrofluosilicic acid is safe and effective, and if there's not anybody else that will, including the American Dental Association, by the way, they won't say that hydrofluosilicic acid is safe and effective. They will tell you that the process is safe and effective. But to answer your question very directly in terms of what studies are available, the National Academy of Sciences was directed by the U.S. EPA to do an evaluation of fluoride. They gave it to the National Research Council. It gets complicated in terms of names, but the National Research Council, the same kind of council that actually did the review on arsenic and came up with a book on arsenic, did the same thing on fluoride. And they established several things. One, that the national standard, the U.S. standard, which is higher than California's, was not protective of human beings. It was a unanimous decision. That all the information that they used before did not support the numbers that they'd established as being for risk assessment. And they came to this opinion unanimously. Secondarily, they came down to the fact that said that they provided evidence of impairment of endocrine system, including the thyroid, that happened well below the amount in fluoridated water, and in fact appears to happen at levels in the amount of fluoride that's in your water already. And so besides that, dental fluorosis, other ones, and I'll let David finish up some of those, but this is an NRC report. During the Metropolitan's only determination to let anybody else speak about this issue was given 5 minutes for Catherine Thiessen, who was the author, one of the authors of this particular 2.5-year panel research for the U.S. government, that when she sat down to do it, they allowed her 5 minutes to be able to show the chart that you saw up here. So if you look at the numbers that are right up here, this is coming right from the NRC book itself, the actual report that came out, where you can actually see the various impairments that happen at the point and how they coincide with the amount of water that people are drinking. What hasn't been spoken about enough is that we have exposures through pesticides, through all these other foods and beverages that are so high that, in fact, we have dental fluorosis occurring when you don't have any fluoride in the water at all. And so there isn't any doubt that this is going to exceed the amount that people are already getting, and we already have difficulties with that right this second. To give you some perspective, in the 1920s and 1930s, the treatment of choice to slow down your thyroid was to put you in a bathtub full of water with fluoride and let it permeate your skin so that you could slow down a hyperactive thyroid.
A question, you said that areas that aren't fluoridated are still showing fluorosis.
Yes.
Could there be another cause?
Dental fluorosis has to come from fluoride. That's what it actually is.
I mean, but your teeth, the browning of the teeth, is there something besides fluorosis?
Dental fluorosis is a very specific, it's very specific, and it can be recognized as being dental fluorosis. There are people who would say differently, but dental fluorosis is actually a specific disease that does several things. To make certain that we are aware of what that means is that it actually affects the growth and development of teeth during our formative years. That's pre-birth to approximately 8 years old. You and I could not get dental fluorosis from drinking a ton of fluoride right this minute. It only happens during that developmental stage. And it can come from swallowing toothpaste. However, it also comes from drinking Coca-Cola. Most people don't realize there's more fluoride in Coca-Cola in San Diego, where we're non-fluoridated, than they would put in our water. That's because it's in part of the phosphate that gets put into the Coca-Cola. It's it's a pesticide for, if you're not eating organic foods, on head lettuce it can be as high as 180 parts per million. So there can be other sources besides, let's say, the 0.3, 0.4 that you would have in your water. There's other sources. And what we're trying to explain is that when you put even more in there, you have more in the whole food chain as well, plus the fact that there's probably an overreach right now. They're continually ramping up the amount of fluoride pesticides that are able to use, the amounts that are able to be utilized on foods, to the point that this whole cumulative exposure is getting higher and higher and higher. So what we've always asked for is, gee, break it down so that you can say how much fluoride comes from food, how much fluoride comes from water, how much fluoride comes from hygiene, and they've done that, actually.
Okay. The question I really asked was, are there any actual studies that show that areas that have had fluoridation for a very lengthy period of time that have shown that it has really super detrimental effects on people?
Yes.
Okay.
Absolutely.
And that's what you just spent the last 15 minutes telling us about.
Well, one of them, the dental fluorosis, is undisputed. There's not any doubt by anybody that when you put fluoride in the water that you have more dental fluorosis than you did if you didn't have fluoride in the water, that there's a direct correlation.
That's the browning of the teeth that you're talking about.
Well, it's more than browning. It's, first of all, it's a bright white spots that you might see, and it's also opaque spots, but it's also browning, and it's also mottling, but it also makes the tooth more fracture prone. It makes it more brittle. And David can speak more to it as he
There are
does.
also studies showing that children that have mottled teeth have a lower IQ. So you have to be a dentist to believe, and these are actually cited in the, I see you don't believe me, Don. The National Academy of Science Neurology Chapter, written by Bob Isaacson, goes through in some detail the effect of fluoride on the neurological system of humans and animals, and that his entire career, he's at age 68 years old, EPA scientist, his career has been poisoning animals with fluoride at 1 part per million. And that is Barner Jensen. So, yes, you don't believe us? I suggest you read the 460 pages of the National Academy of Science. It's excruciatingly detailed, and you will enjoy it.
But I have to, again, accentuate, if you actually pull out the study on hydrofluosilicic acid, you'd resolve the issue. But because not one of you or anyone else in the United States can come up with a study on the actual substance being placed in the water, it becomes moot as we all talk about the general philosophy of fluoride, as far as I'm concerned. So all you have to do is ask for it, is what I would ask for, and I believe that most of your community would expect from you.
Well, it sounds like there have been a number of testimonies given before Congress on this issue. So did Congress take any action based upon fluoride being a bad thing?
No, it's an excellent question. And the reason why they haven't is because Congress in 1974, in the middle of the Safe Drinking Water Act, that most people are acquainted with these in terms, right in the middle of it, they state that there cannot be any primary federal regulations that require the addition of any substance that's intended to be preventative except for the potability of water. So in essence, the federal government, that's what I went and got a congressional investigation for in the first place, the federal government says, we gave it up. We don't even deal with direct water additives anymore, period. They just don't do it since 1988. And so this is not a federal, there's no federal determination on this. This is a state-by-state process. And that's the reason why the whole country's not fluoridated already. Otherwise, there's enough money out there probably to suggest that everybody should be fluoridated at this point. So the federal government isn't acting because it's a state right this second. And prior to 1995, in 1995, it was true in California that it was only a municipal affair. And that's what the allowance of putting fluoride in the water was. It was a municipal affair, but that was also what protected people from being fluoridated also was a municipal affair. Did I answer that for you?
But I find it hard to believe if the federal government wanted to get involved in a health issue, it could not find a way.
Well, it does. And so what you find out is that the Centers for Disease Control is acting all the time, and it doesn't have any authority to do so. So right now, they've just filed an ethics complaint to find out why aren't you providing all the information that you have available instead of the ones that you're supporting and trying to sponsor it. And where's the authority come from to be able to do that? So the questions that happened in the congressional investigation that they allowed us to write were directed to the FDA, for an example, and the FDA was asked, is if you're utilizing fluoride for the purpose of reducing tooth decay or anything else like that, is it regulated by the FDA? And, is it basically considered a drug? And they stated yes. Now, the difficulty is they don't have an action that they're taking with it because all of the claims are about the public policy instead of the substance. And that's why we've tried to clarify for you what the difference is.
Okay, gentlemen, thank you for your extensive presentation. I see we have a number of residents here that want to discuss this issue. Okay, folks, we're not going to be entertaining applause during public comments. So you had your chance. Thank you. We'll open it up to the rest of the public for public comments. Come on down, or else I'm going to close public comments. We have other agenda items that we need to get to.
Hello.
Hello.
I'm Christine Carr. I wish I didn't get so nervous talking to all you guys. But
We're nice people, Christine.
I live in Newport, and I'm 60 now, and I started scrubbing instruments in the dental office when I was 15. And for about 30 years, I was in the dental office, and I used to think I was just a dental humanitarian. Now I'm just a humanitarian. And the fluoride isn't necessary to put in the water. It never has been. It's, when this gentleman talked about the white marks on the teeth, not once in a while, but different times we would see it on different individuals and go, "Okay, well, what's that?" And the dentist, and by the way, I only work for good dentists. If somebody wasn't committed to the best service, I didn't want to work for them. And in this area, there's a lot of dentists, but there's only a few really good dentists in our area that would probably really stand up and tell you the truth. If this is something attached to money, I don't know, because the American Dental Society, it's going to be probably difficult to get them to really stand up and really talk about this issue. But through this whole history, I've never seen for someone's health that it would be good to take this fluoride long term. And it really is an individual choice. I'm sure that there's some incidences where somebody might need to have it, topically, or, if they have a lot of dental caries or something like that. But you can do that in the dental office, or, they have home treatments. And it has to be attached to some sort of money, or something's going on somewhere where this is coming up. So I'm upset about it. Thank you.
Thank you, ma'am.
I'm Dick Nichols from Corona Del Mar. I have had a little bit of association with this for the last 35 years. Because 35 years ago, I did a little study while I was in grad school, came to the conclusion that's being voiced here, that it does not help one, and particularly one that's an athlete, because if you drink a couple gallons of water a day, you're bound to be getting way too much fluorine and these kinds of things if they're in the water supply. I was in a city that had that, which is Evanston, Illinois, and I'm damn glad I didn't. What I did notice is that my whole mouth is full of cavities. My whole mouth was full of cavities by the time I got to college. I haven't had any more since. I have had a couple cavities that had to be capped instead of cavities, but I have had no more dental problems. My wife, since she got involved, hasn't, and my kids haven't. My kids are now on their own and they're doing other things, and they're starting to have dental problems. So I would tell you that this certainly isn't needed for dental. I have a couple questions, and I think they were answered, but I'd like to just point it out. We have some natural fluorides in our water, and they're apparently not only here but in Irvine. 2, mixing. As shown there, you can't mix this. With the equipment to mix this, you can't just, we don't put all the water that comes from MWD into a reservoir, and we don't mix it for 5 days in a reservoir in a circle and keep mixing and mixing until we get an average concentration and then send it out. Some of that water goes out to people on the way. Some of it goes out differently. So you have a whole range of concentrations across your city, and it's going to be from 0.8 to 0.2 if you don't do it. If you don't add more fluoride. If you add more, well, Irvine was asked that. The Irvine Water District said, well, they are not going to add any more. And so basically what they're saying is that their current level was 0.1 to 0.4. This would bring down the average in their district, and so that they would get it down to something in 0.7. This is a very wide speculation on this. I don't know how close they can even hit it. How good are the chemicals even? The chemicals are only tested once a year. They're bought like you would sand or something. They are not bought like a medical. This isn't a medical. That's why they can't get any specs on them. The people just don't furnish them. And then finally, as I mentioned before, how do you get the correct amount? If you're a small child, you shouldn't have any in the first place. If you're growing, if you're a swimmer, if your kids are and that kind of thing, you got to watch it. This is much better to handle on an individual basis. If you want fluoride, you can have it put on it. The dentist, this is a medicine, and fluorine is the most corrosive acid that you can have. And hydrofluoric acid is the only acid that etches glass. If you put this fluorine in water, just throw it in, it'll explode. That's how fast it reacts. So this is faster than anything else and much stronger than anything else. Thank you.
Thank you, Dick.
Hello, my name's Kathleen Turpin. I'm a resident of Newport Beach. I was watching television last week, and I was horrified to find out about what's going on with the water. I'm a mother. I'm a grandmother. My concern is child endangerment, and I want to know specifically the toxicity of the water that I'm drinking. And I know all of my friends and neighbors want to know that same truth. I don't think it's appropriate for it to be snuck into our water supply. And I feel that the voters need to be notified. And I will do everything in my capacity to notify all my friends and loved ones about this potential endangerment to all of us. It's not appropriate. It has no business in Newport Beach. It will bring down our property value that we've all worked so hard to maintain. It's not appropriate, and it does not belong in our city. Thank you.
Good evening, Mr. Mayor, Council, and staff. Larry Porter, 2712 Cliff Drive, Newport Beach. I want to urge you to do everything you possibly can do to thwart this addition to our water supply. Bless Dr. Kennedy and the other gentleman, his name slips me right now, for appearing to add validity to the argument that this is a most gnarly bad addition to our water supply. I would like to pass out to you some handouts I believe that would get you up to speed, and I hope minimally you spend, I would say, a considerable amount of time on this issue, because it's come on my radar screen that this is not a benign addition to our water supply. For all of those reasons you've just heard, those gentlemen crossed the T's and dotted the I's much better than I can. But Homer Short, here are some that I forgot to staple that came out of an English book about the elements. I'm a budding chemist in the ways of water, and I'm studying to pass my Water Quality Association certification. And one of the things you have to learn is chemistry. And so I'm going through in the periodic table and studying the elements, and I've got chemistry books, and I'm being confused, but slowly I'm learning, you guys. And fluorine definitely is one of the gnarly chemicals that changes everything it comes into contact with. It's known as a halogen. There's fluorine going vertically down. Fluorine, is it chlorine, bromine, and iodine? And these elements, they are what you would use if you want to destroy life, you want to kill things. If you want to change something, they're like Mike Tyson when they get next to another element or a molecule or a compound. They change it. That's why I'm not a doctor. It's not real hard for me to connect the dots. Yes, that it could cause problems with the thyroid system. If you don't have just the right amount, you've got real problems. It is topical. It's not to be ingested. It's going to play silly buggers with you once it gets inside of you. I am a dental basket case. These are all fake teeth on implants. Now, going from when I had really poor teeth to here, they gave me, to swish, a ginormous dose of really strong fluoride. And I would swish it, and I did my best to get rid of it all. They told me, you get rid of it. You spit it out. You don't swallow this stuff. Don't do it. Well, I did my best, because as soon as I got it in my mouth, I knew I had something in my mouth that I did not want to stay in my mouth. And just a little bit getting down into my stomach made me want to retch big time. It's gnarly, you guys. Do whatever you can to not put it in the water. And the health of the people of Newport Beach will definitely be much better absent this chemical. Thank you very much.
Thank you, Larry. Getting a workout there, Dolores.
Lose a pound. Hi, my name's Dolores Odding. I live in Newport Beach. I want to thank you for being as gracious as you are today. Thank you very much. There's a great book out here called The Fluoride Deception. It's written by a gentleman named Christopher Bryson that spent 10 years writing this book. And what he got was information that was declassified from the days of the Manhattan Project. And Councilmember Curry, I know you fly a lot. You're going to love this book. I mean, this is the most intriguing book. This is like, it doesn't have sex and romance in it, but it might as well, because it's going to make a phenomenal movie. And it's all about fluoride. It answers all the questions that you're talking about. It's, okay, then I gave you a handout about fluoridation. I want to read to you what was written by Councilmember Keith Beyer, because it's the best description of what's going on. And what he said down in Escondido was, and I searched, I've been doing this for like a month now, and he says, I wasn't elected to sit idly by or to provide political cover for state legislators that rubber stamp industry's attempt to recycle hazardous waste by dumping it into our drinking water, said Escondido Councilmember Keith Beyer. Our water department calculates that we would be buying more than 33 tons of a substance that can't be given to us for free because it is classified as a toxic hazardous waste. Yet we are supposed to accept that if we pay 35 cents, and that was in 1999 prices, per gallon, that they slap a new label on the container, the same toxic waste can be shipped to us untreated directly from the scrubber systems of the phosphate fertilizer industry that they use to keep fluorine from becoming airborne and killing everything in sight, and that on that truck ride here it will magically be converted to a safe and desirable nutrient. The kicker to this scream is that the amount intended for the targeted children, now this is for the children, is only 16 pounds of the 33 tons that they would be buying per year. When you also, I gave this to you the last time. It's from the EPA Professionals Opposes Fluoridation. What's very interesting is the very last paragraph. When they started the fluoride, they did studies, and there was a comparison. There was Newburgh, which was fluoridated for 50 years, and there was Kingston, New York, which wasn't fluoridated at all. So they had a control group to go by. And what they found out 50 years later is it didn't really make much difference, is that the cavities are the same in both groups. Because now what they're stating, and I forgot that, but anyway, it talks about how topically fluoride works, but not ingestion-wise. And they also noted that European countries don't fluoride, and we do, and studies today show we have the same amount of dental decay, and that in Newburgh, where they do fluoridate, it is a higher fluorosis study. Also, there have been some type of studies that relate osteosarcoma, which is bone cancer, that occurs mostly in boys, unfortunately. And what it happens is, as you heard from Dr. Kennedy today, fluorosis makes the bones more and more brittle, and when they go through bone spurts for some reason, the fluoride's there and they can get a tumor. And they normally will get cancer at 17, 18 years of age, 16. And some of them will live, but they will live with amputated limbs. Another thing is that we're going to get the double whammy. We're going to get the toilet-to-tap water, and so we're going to be recycling and recycling and recycling. So this and they're going to be Metropolitan Water District, and that's one thing you have to realize. They're a wholesaler. They're not going to have any liability. You are in the chain that will have liability in the end. They're going to give us 1.2 milligrams, and it's supposed to get attenuated as it comes down to us in Newport Beach, and so it's going to be at 0.7 to 0.8 milligrams per liter. And I'd like to, and what we have to take into account is every single time we're going to recycle the same water, because we're doing toilet to tap. It's going to go in the toilet, and it's going to go and up in Anaheim, and it's going to be, they're going to have reverse osmosis, and they're going to have ultraviolet light, and they're going to percolate it down. So you don't get rid of fluoride that way. Fluoride is, as you know, is very, very, very light. It's a very pesky little thing. And so you might get rid of 90%, but that's a question I want answered, is after how many times does this go up, so that right now it's 0.4, in 3 years is it going to be 0.8, is it going to be 0.9? And also, I know we have our water reservoir covered here in the city, but I was wondering if there is any evaporation at time, because what happens is in the American Dental Association website that says to ask your pediatrician or your doctor if you need to sterilize the water, and it makes sure that it says that sterilization will not eliminate fluoride. So we know that when you cook with it and you boil it, it's going to be left at the bottom. The other problem I'm having is pools. The pools in Newport Beach, the swim team, my pool. Every day I fill up more water. Every day it evaporates. It evaporates. And so the fluorine level, or the hydrofluoric acid level in my water is going to be more and more and more, because I'm going to keep adding more water, but the water evaporates, the fluoride doesn't. We're going to stick the kids in this up at, Marion Burgess Pool. Are you going to test the water there? Are you going to test it on a regular basis? I know, Steve, my time is up. But this is a very serious issue, because inhalation and dermal absorption is 100%. So that's something I would like answered also. And I also want a copy of all the contracts with Metropolitan and with Fountain Valley. Thanks.
Thank you, Doris.
My name is Barbara Caldwell. I live in Corona Del Mar in County Highlands. And I just got back from a business trip, and I heard about this yesterday. So I had purchased Dr. Kennedy's book some 10 years ago at Mother's, and there was another dentist that put out a book, and I've done a lot of research on the internet, and I'm just so upset that we don't get to vote on this, that you don't get to vote on it. It's just happening. And if there's anything you can do to stop it, I would appreciate it. The Department of Water and Power, they said that the levels that they were going to put in were based on water consumed and ingested. I drink a lot of water, and like we can get it maybe in our swimming pools, and if we're cooking spaghetti or rice and it's in our food, and if we're getting it from so many other sources, and if it's not really fluoride, it's a byproduct, it's a waste product of an industrial companies, and I don't know why we'd have to pay millions of dollars for it when they're just happy to get rid of it. But I really don't want to see it in our water. So please do whatever you can.
Thank you, ma'am.
Good evening. I'm Isla Johnson. I'm not a Newport resident. I live in Costa Mesa, but I'm going to be affected by this too, and I'm very concerned about it. And I too want to thank Dr. Kennedy and the other gentlemen for the in-depth presentation they gave us. I'm a registered dental hygienist. I have a degree in dental hygiene from the University of California Dental School. I have 30 years experience in private dental offices, and I am adamantly opposed to this imposition of medication on us. And as has been pointed out, this is only effective for children, if it is even effective in preventing dental caries. It has to be ingested during the development of the teeth, while the teeth buds are still being developed. So they're suggesting that you impose this on a whole population that won't even get any benefit from it, if there is such a benefit. So I ask you, please don't impose this on the residents of Newport Beach, and I'm going to, pray that Costa Mesa decides not to too. Thank you very much.
Thank you, ma'am.
Good evening. My name is Blythe Fair from Corona Del Mar. May I?
Everybody else has. You might as well pass them out.
Well, I don't know if I'm supposed to give it to you each individually or so. Many of the things have been covered beyond my ability to do so, but there are a couple of things in my research and my understanding of why I do not choose to be medicated against my will, and I am really asking and imploring you, our elected officials, to represent us and protect us. If someone wants to do this, let them choose it on their own, but I don't choose to have it. And I don't want to have to buy reverse osmosis, and I don't want to have to buy bottled water, which is more plastic and petroleum, that whole issue. I don't want to pay more taxes for those things to be given something that I don't even want, or that can cause further health-related issues down the road. Many of the things on my notes here have already been covered, so I'm just going to go straight to the points. And you'll see these. You're asking what studies have really been done. And you'll see people from, whether there's the AMA quoted here, the Federal Minister of Public Health, Nobel Prize Peace winner, all these people saying, no, it's dangerous. And then also, most of Western Europe, 98% of it has abandoned the use of fluoride, and so have many U.S. towns who've had it open to a referendum in the study. A couple of things that I don't think were touched on were that learning disabilities and behavioral disorders are often associated with fluoride, and that actually it has been used in prisons to modify and tone down the behavior of the prisoners. There's a bunch of dumb sheep running around, right? Anyway, The other thing is that Alzheimer's disease has been linked to the bioavailability of aluminum that finds its way into the brain. It actually doubles the amount of aluminum deposited in the brain when there's fluoride there. So we have a much greater risk of Alzheimer's because of that. And you've already heard about the osteoporosis, carpal tunnel, arthritis, the brittle bones, and it isn't just children. Yes, I'm all for protecting children and my grandchildren and so on, but we have to take care of ourselves also, and there are plenty of older people that are having a lot of problems. One of the quotes you'll see in there is from Dean Burke, the chief chemist of the National Cancer Institute, in 1981, before the congressional hearings. He said that 40,000 cancer deaths in 1981 were directly attributable to fluoride. And that's 40,000 people that died of cancer that were mentioned, not all the others. And that's back in 81. And as many people have pointed out, the concentration is developing. Every time a pot of soup is boiled, it's more. Often infertility is associated with it, thyroid disorders. Even recently, you probably noticed an article in the paper from Rogers Gardens. Their master gardener, Ron Vanderhoff, was saying that you can see the unhealthiness in the plants as the leaves brown and the plants don't do as well. If it's affecting the plants, it's going to affect us. And we haven't even talked about what it's going to do to the ocean that's already suffering. My husband works in Fountain Valley, and he has been drinking that water for about 19 years. And he is the model of health, and we eat organic and knows that all the things. But his thyroid and his arsenic levels, it's not me, have been tremendously elevated, and the doctor cannot figure out what's the matter. And when I've been doing this homework on what fluoridation does, I'm seeing Fountain Valley is responsible for my husband's health decline. And I really think that we need to look at it that way. It's like you can't just keep passing off who's responsible and so on. And personally, when someone chooses to smoke, okay, and they choose to sue a tobacco company, I don't quite understand that because of the personal responsibility and accountability involved. But if I am medicated against my will, I would really not hesitate to sue. How in the world can these corporations, municipalities, or the individuals that okay these things not protect us and that let us choose that? Thank you.
Thank you, ma'am.
Hi, my name is Chris Sullivan, and I'm from Corona Del Mar. Pretty much everything I was going to say has been said, except for a few things I do want to go over again. I feel very strongly, like Blythe just said, that I really don't want to be medicated against my will. I feel that all of us, there's a large number of us in this city who do not want fluoride in our water. What is the alternative you're going to give to us? Are you going to buy us reverse osmosis machines that are going to waste more water just to try to remove at least 80% of the fluoride from our water when we drink it? What's going to happen to me and my child and my husband when we take a shower and we absorb directly into our bloodstream all of this fluoride along with all the chlorine that's already in it, along with drinking it? I mean, there's so many different things that you guys who are our custodians, really, we elected you to be our custodians here in the city, that you need to think about. And I believe you guys do have a choice. It sounds like you do have a choice, that you can make a decision as to whether or not you want to buy this water or not. The other thing that really hasn't been touched upon that much, and that is the ocean. Blythe mentioned it. What about our bay? What about all the runoff from people's hoses and everything else that goes into the bay, into our ocean with fluoride in it, which as it accumulates, what's it going to do? Have there been any studies yet done on the effect of fluoride on these, sea creatures and the plants in the water? If it affects the plants in our gardens, what's it going to do to the things in the ocean? So these are all very, very, very serious concerns I really urge you all to consider, not just blindly rush into accepting this deal, but to think about what it's going to do to all of us in the long term, especially our children. Thank you.
Thank you, ma'am.
Good evening. I'm Portia Weiss, and I'm a resident of Newport Beach and a mother. I really plea all of you to take into consideration the information that was presented today. I really feel that we all deserve the freedom of choice, not to be medicated, to have pure water I think we've all had good friends and family. We read about people every day in the newspaper that are taken prematurely by different kinds of cancers, and there are so many, no one can really link exactly what is causing all these cancers. Why add another chemical to our environment that doesn't really seem to be necessary? And we're all trying to get away from bottled water because of all the carcinogens linked to the plastic estrogens, chemical estrogens. It's been linked to infertility and all these other problems. Please don't add one more concern to us. And I think you've all done a beautiful job with all the legislation that's going on in Newport Beach. And I think let's kick this one out and focus on the things that we really need to. So thank you for your time.
Thank you, ma'am.
No on fluoride.
Anybody else that'd like to speak on this matter? Okay, seeing no one, I'll end public comment section, bring it back for discussion by council.
I have a very basic concern here, and that is that we're talking about public outreach. And I don't think it's public outreach when it's a done deal. It's just a notification. This seems to me this process really should have taken place before the decision was made. It's difficult to sit up here and in an hour decide what the science is and whether there's a problem or whether there isn't a problem. I mean, very difficult. But I am concerned about, it doesn't matter what the science is in a sense, if we have enough people concerned about it. You're right. We've been trying to drive people back to tap water because of the problems that bottled water provides. Well, this is going to have everybody drinking bottled water. We're going to have more plastic. We're going to have more aquifers depleted. I'm just wondering that if we couldn't ask at least for a delay of the process so we could have more time to answer these questions for ourselves and for our constituents. That might be a possibility. I don't know if they would respond to it, but it would be something that we might think about.
I have kind of a question of, I guess, either our city staff or the MWD people. The presentation we had said we get 82% groundwater and 18% is going to be this fluoridated water. Is that correct?
That's right.
Okay, and
This year only.
okay, or maybe more.
Could be as much as 65%. Could be as much as 65%, 35%, depending on the various.
35% MWD water.
35% MWD, 65%.
Okay, so do we have, as a city, do we have alternatives to buying water other than MWD water?
No.
I mean, where else would we get water if we wanted non-fluoridated water?
We don't have any alternatives. It's Metropolitan Water District water or the groundwater.
Okay, can we pump more water out of the aquifer to make up for the loss?
Now, we're members of the Orange County Water District, and that basin pumping percentage, which is set every year for all the groundwater producers, are set for everyone. That number, that percent, that 82 that we have this year, is for all the pumpers that are members of the agency or a member of the basin, and that's out of our demand. So I know it's kind of a hard number to understand, but if you have 18,000 acre-foot of water that you pump in a year, 82% of that can come from the ground. That's the maximum amount.
Mm-hmm.
So this year, as Don mentioned, is 82%. Next year, maybe 75.
Yeah.
It's based on the availability of water in the basin. So
Okay.
we pump to
So
our maximum.
I guess what I'm getting at is there an option to take more water if we didn't want this MWD water? Okay.
Well, I could say we could overpump the basin and run into penalties, which could be 3 times the cost, say, of water, which we wouldn't be budgeted to do. So in other words, 100% of the groundwater run into penalties to use that 18% of our demand, which would be millions of dollars.
Okay, so our alternative would be pay penalties, triple the rate or whatever that is,
Correct.
or reduce our consumption every year by 18 to 35% in order to not use this water? Or would our
It's
actual
always-
percentage be reduced from the aquifer, even if we did conserve?
If we reduce the use of water demand-wise within the city, that 82%, it's 82% of the demand. So if we use 18,000 acre-foot this year. Next year, we only use 15,000. It's 82% of that 15,000.
So we're
that
down if we do and we're
percentage-
down if we don't, basically?
Correct.
Okay.
George, could they kick us out of the underground water district if we exceeded our 82%?
Yeah, since we are part of the Orange County Water District, and it's an agreed upon number with all the basin pumpers. If we continue to pump over that basin, it's called replenishment assessment. We pay a fee for the water that's actually put into that basin. If all the pumpers continue to pump over that allocated amount, of course it draws the basin lower and lower and lower. That affects all the other agencies. It would be something we'd either be out of the basin within no time at all.
I have just one other question. Where do we get I mean, I know we're talking about toilet to tap water. I mean, where does all the water that percolates into the aquifer come from non-MWD sources?
Actually, which I think was referenced was this toilet to tap. This that GWRS program that Orange County Water District is doing that's going online in November. And that takes reclaimed water and pumps it up to the Anaheim lakes to percolate through the soils, which could take 10 to 20 years to naturally go through the basin.
George, wait a minute. It's not reclaimed water, because the reclaimed water does not have the level of treatment.
Correct. You're right.
The water that goes in the groundwater replenishment program. It's water that has run through a reverse osmosis process, as well as can't think of the name of it right now, but it's something that I would not myself have any problem just drinking directly. I guess the thing that I heard today that concerns me more than anything else is that my Coca-Cola has so much fluorine in it that I should not even be here now because I drink all the Cokes that I drink. But
right.
Go to 7-Up.
One question I have on the other members of the Orange County Water District that are they have certain percentages. Do they also get water from MWD? Other alternate percentage?
Correct. To make up the 100% of demand, all agencies buy water from Metropolitan Water District.
Correct.
It's the only other water
we would
source.
not be the only county in Orange that would want to only be taking our water from OCWD if the residents of the other cities in Orange County share the same concerns as the residents.
Right. Everybody's going to be short.
The other thing is not all of Orange County is on the groundwater basin. The southern portion of the county is 100% MWD water.
Right.
Correct.
Rich, I had a question for you.
Sure.
Go ahead.
He was next.
Thank you, Mr. Mayor. I think the mayor's questions sort of demonstrate the impracticality of cutting ourselves off from anywhere from 18 to 30% of our water supply and inducing a drought sort of out of the box. I think that's probably not an acceptable alternative. But I think the residents have raised a variety of health issues, and what I'd like staff to do is to listen to the tape and prepare a series of interrogatories for Metwater so that we can have, I won't put Mr. Dimely on the spot, but some scientist at Metwater respond to those health issues that have been raised by the citizens. I'd like to see us post that on the website so it's available for people. I'd certainly like to know if the answers come back anything other than a certification that this is healthy for the citizens, so that we've had an opportunity to have them respond specifically to the health issues that were raised today, and people have the benefit of those answers.
Councilwoman Daigle?
If I may ask now that MWD is here, I had a question on another issue in the newspaper today about rationing, and I had attended a dinner UCI put on at Mission San Juan Capistrano. They had a board member of MWD, and they said we did a lot of great pre-planning, never have to ration. And then this morning there was some discussion of rationing. Can you address that?
From the MWD standpoint or for the city of Newport Beach?
From MWD.
Okay. Ed, maybe Ed.
With all due respect, council member, I'm not in a position to address those issues. I'm sure if you can get the appropriate Met person to address those, because I need to keep my job, so I don't want to say anything out of turn. Let me speak to one issue. When this issue was the issue of fluoridation, that is, was deliberated before our board, a lot of the issues that were raised today came to our board. Consistently, Metropolitan, and I want to make it clear that Metropolitan has invested literally billions of dollars in the safety and the treatment of our water. We would never do anything to compromise that. Despite what was said here today, that's something that our board of 37 members have emphatically emphasized through every aspect of our treatment. What I would recommend to this body is that if you have questions relating to the health and safety of the water, you get the appropriate public health official here. We've had federal, state, and local officials address our board. They have insisted that at the level that we're practicing it's safe. anyone who questions that, they do it at direct contradiction to those folks. I would urge you to get those folks here to address those concerns. Thank you.
Thank you, sir.
I think it would be interesting to get someone from the Orange County Public Health, since they instigated apparently the request, to have them answer the questions. My dealings with the health agency have always been very good. I have confidence in them, and they could perhaps answer some questions also, may get a couple of perspectives there.
I'm sorry, I may have missed it earlier. When would we expect to receive fluoridated water? Okay. Thank you. Is there any?
Councilmember Daigle, I don't know if that answered your question or not, but we
Probably
get
we can
some
look into
information
that
on
more, the
map.
rationing.
Yeah, okay.
We don't have full information, so that's
Right,
okay.
right,
Thank you.
Okay, any further questions? All right, we'll conclude this study session item. We do have one other study session item, but I don't believe we have enough time to adequately address those issues, so we will put that off. The item on updating our citywide Wi-Fi network. We do have a rather extensive closed session agenda that we have to get to. So with that, I'll ask for public comments on non-agenda items.
I can tell you that, hi, my name's Dolores Otting. I spent 9.5 years in a nursing home down the street taking care of my mother-in-law on a daily basis. And I had to come before you, the city council, in order to get something done about the air conditioning, because I did go through all of the health agencies on a continuing basis within the state of California, starting with the Attorney General's office. I don't know. This is just, and I know this is another agenda item. So anyway, I'll be here tonight, and there'll be public comments, and so there's a few more things I want to say on fluoridation. But I don't want to be medicated. I don't think anyone wants to be medicated, and I know that you guys don't want to be medicated. And you have to read the book. I'm repeating myself, and I thank you for the indulgence, but you really do need to get the book. It's a phenomenal read. Thank you.
Any other comments on non-agenda items? Okay, seeing no one, we're